أكيد فعلاش بنعالج. Of course we can treat stroke. Today in 2018, with all the medical development, all the new technology, we have come to a point where we can treat it effectively, and we can make a huge difference in patients' lives. There are two kinds of strokes. The first one, which is hemorrhagic stroke. The second kind of stroke, which is more common, 80% of patients are affected, is what we call the ischemic stroke. And that specifically relates to a blood clot traveling to the brain, occluding an artery feeding the brain, and depriving the brain from the nutrients and the oxygen and the blood flow that it needs to survive. There are many symptoms that can actually represent a stroke. First, when you notice that the patient's face is asymmetrical, the face is drooping towards one side, the smile is crooked, or if they stick their tongue out, they cannot open their mouth as you would like them to do. Second is when the arm starts dropping down. You ask the patient to keep their arms up together and symmetrical, and they cannot. One drops down. Third is when the speech becomes gobbled and you cannot understand it, you cannot understand what they're saying, or when they cannot understand a question that you ask them. And then it is time to call for help. That is where the acronym FAST comes from. Most strokes are actually preventable. Eat a healthy diet, avoid red meat, avoid egg yolks, heavy cheeses, and deep fried foods. Do not add salt and avoid added sugars. Do not smoke tobacco. Get moderate exercise and make regular visits to the doctor and follow directions on all your medications. The brain is the most precious organ God has given us. It is the organ that makes us think, that makes us love, that makes us compassionate, that makes us intelligent, that makes us productive. So do everything you can to protect your brain. The best stroke you can have is the stroke that you've never had. I'd rather that you don't have a stroke rather than us treating it.